Hi guys, today I want to talk about equine metabolic syndrome. As springtime comes, this is a great time to discuss this. So what is equine metabolic syndrome? Well, it's a condition that is often genetic but can also be triggered by poor health management. It affects how horses, ponies, and donkeys metabolize. Symptoms include fatty deposits, usually crusty necks, bumpy buttocks, excessive hair growth, lack of shedding, increased weight gain, infertility in mares, and sometimes swelling around the eyes. Most concerning, horses with EMS have a much higher risk of developing laminitis, a painful and potentially life threatening hoof condition. So, why are metabolic horses prone to laminitis? A primary effect of metabolic syndrome is insulin resistance, meaning the horse's body doesn't respond properly to insulin. Insulin is the hormone responsible for moving sugar from the bloodstream into cells for energy. In a healthy horse, this keeps blood sugar levels balanced. In a metabolic horse, this process doesn't work properly, causing blood sugar levels to remain elevated, especially after consuming sugary foods. When a metabolic horse eats a high sugar diet, blood sugar levels spike, causing the pancreas to release excessive amounts of insulin in an attempt to regulate sugar levels. However, high insulin levels in the bloodstream can be toxic to the laminae, the sensitive tissue inside the hoof that connects the hoof wall to the internal bone structures of the foot. When this excessive amount of insulin is released, it triggers inflammation in the laminae, causing it to swell. When inflamed, it's weakened and loses its stability. This inflammation of the laminae is known as laminitis. As the laminae swells, it can also restrict blood flow to the hoof, leading to tissue death. In severe cases, the combination of tendon tension and the horse's body weight can cause the coffin bone within the hoof to rotate or sink. This is known as founder. Both laminitis and founder can be career-ending and even fatal. Which brings us back to springtime. As seasons change, grass transitions from its dormant stage to active growth. Sunlight drives photosynthesis, producing sugars for energy. In early spring, cool nights slow down plant growth, causing the sugars produced during the day to accumulate in the grass leaves. As a result, spring grass contains a much higher concentration of sugar than other times of the year. For horses with metabolic syndrome, consuming this sugar-rich grass can cause a sharp spike in insulin levels, which significantly increases the risk of laminitis flare-up. So what can you do to protect your horse? Feed a low-sugar diet. Reducing sugar intake is crucial for both preventing and managing metabolic syndrome. Make sure you're also testing your hay, not only focusing on grain products. Limit access to spring grass. During seasonal transitions, closely monitor grazing and consider using a grazing muzzle or dry lot to control sugar intake. Consider medical support. Supplements or medications such as Thyro-L can help. Support like Thyro-L tell the body to increase metabolism and slow down insulin release, which help reduce laminitis flares. Understanding how diet, seasonal changes, and medical support affect your horse's metabolic health is key to preventing complications. By staying informed and proactive, you can help keep your horse healthy and comfortable, especially throughout the changing seasons. Always consult your veterinarian to determine the best management plan for your horse's individual needs. So here's to wishing everyone a happy, healthy, and safe season this year.